Tonight, Jamaica recorded 271 new COVID-19 cases and 7 additional deaths, taking the total of cases to 20,581 and the death toll to 391. Health and Wellness Minister urges citizens to take the COVID-19 precautionary measures very seriously, as hospitalization is a big concern.
We continue to prepare our hospitals to accommodate those persons who need hospitalization. We, however, want to advise citizens to please take the precaution, because hospitalization is a big concern and we don't want to get overwhelmed.
Still tonight, the police are seeking the public's assistance to locate 25-year-old Lynette Blake, otherwise called Cindy, of Ashton District, Westmoreland, missing since February 12. And Salada helps Jeb Memorial Basic School stay connected to online learning with a $1.5 million donation.
We are Jeb's family, not just in words but also in deed. And so this morning, I am especially pleased to provide to Jeb 45 tablets, 3 laptops for teachers,
Good evening. Jamaica has recorded 271 new COVID-19 cases and 7 additional deaths within the last 24 hours, taking the total of cases now to 20,581 and the death toll to 391. According to the Ministry of Health and Wellness, the 7 deaths include 4 women, comprised of a 71-year-old and a 59-year-old from Kingston and St. Andrew, a 74-year-old woman from St. Elizabeth, and an 87-year-old woman from St. Anne. There were also 3 males, 2 aged 75 and 85 years old from St. Anne, and an 89-year-old man from St. Catherine. Of the 271 cases, there were 117 males and 154 females, ranging in age from 6 days to 86 years. The cases were recorded in Kingston and St. Andrew with 87 cases, St. Catherine recorded 49 cases, St. Anne 34, Clarendon 25, St. Thomas recorded 22 cases, Manchester 18, St. James 16, Hanover recorded 7, St. Elizabeth 5, Trelawney and St. James recorded 3 cases each, while Portland and Westmoreland recorded 1 case each. The country also recorded 47 recoveries, taking the total of recovered persons now to 12,828. In other news, Dr. Delroy Frey, clinical coordinator at the Cornwall Regional Hospital, CRH, in Montego Bay, says he is confident that the Cornwall Regional Hospital can adequately facilitate COVID-19 patients even as the numbers increase dramatically by making additional space available from other wards.
We look at the numbers we have and we anticipate who will come in and we make accommodations for it. But we are able to do that now and plan ahead, because we have to take out some of the medical space to put COVID patients. And the truth is, COVID patients are really medical patients. And we have a facility in Falmouth which near its completion, we should get on board. So I think we'll be able to manage once the thing don't storm out of proportion, and that's what we are hoping. We have to prioritize, It gets out of proportion where people need to admit. We have to use other ward space and decrease our surgical admission, medical admission. So that by itself would have a problem for patients, but we just have to do what we have to do. But since it started, we are able to manage, and I'm hopeful that we'll be able to manage this pandemic.
Dr. Frey is imploring persons to adhere to the protocols put in place by the government as a means of slowing the spread of the virus.
But this is what I keep preaching. People must adhere to the protocols. We don't have a choice, and I keep emphasizing it's easier to prevent than to treat. I mean, you see the consequence of what is going on. People are just not adhering. We must minimize our exposure out there, and we must wear the face mask, do whatever the ministry says. And that's the best thing we can do at this point in time.
Meanwhile, Health and Wellness Minister Dr. Christopher Tufton, in yesterday's COVID-19 digital press briefing, urged citizens to take the COVID-19 precautionary measures very seriously, as hospitalization is a big concern.
We continue to prepare our hospitals to accommodate those persons who need hospitalization. And you would have seen in the past week where we announced the additional bed count, 133, when all are totaled, which includes the St. Joseph's new wing, as well as the additional 21 beds at St. Joseph's, the 36 at Falmouth, the field hospital that the U.S. donated of 40 beds, which is going to be relocated to Spanish Town. There are some other adjustments taking place, but it is certainly a fairly large increase from what we have. And we, however, want to advise citizens to please take the precautions, because hospitalization is a big concern and we don't want to get overwhelmed.
The minister also gave an update on the country's vaccination plan.
We continue to work to secure COVID-19 vaccines through our arrangements, starting with COVAX, which we have spoken to at length in the past and in the Parliament and elsewhere, and also, very importantly, trying to secure vaccines through a number of our global partners, institutional partners, like in the region, CARICOM, but also bilateral arrangements with governments and manufacturers. Currently, we are expecting the AstraZeneca vaccine manufactured by SK Bio, Republic of Korea, and the Serum Institute of India, respectively, as well as COVID-19 vaccines manufactured by Johnson & Johnson and Moderna. And there are active conversations going on to secure from these manufacturers/governments. We are not dependent on COVAX alone, and that's an important point.
Dr. Tufton explained that the funding has been set aside to purchase the doses needed. However, it is not a matter of availability of the vaccines.
The government has taken a shift in the approach to securing vaccines. Unlike in the past when we said it was 16% we expected during the course of this year, although in fairness, we did say we would seek outside of COVAX. COVAX had made a commitment of 16%, 450,000 people. We are in a position now, based on the budget, to say that we have the resources to secure vaccines for some 2 million Jamaicans, which means that we have allocated over 34 million US dollars, or some 5 billion Jamaican dollars, for these manufacturer facilities. So the discussions that are taking place now are around how we secure the stocks of vaccines, not whether or not we can afford it. We have blocked those funds, the government, and therefore it really now is a function of whether we can get it. Now, I want to say that it's a challenge. I mean, the 3.5 million doses that we're hoping will be procured, which would mean some 2 million Jamaicans would be able to get the vaccine this year, in 2021, has to be a function of the availability of the stocks. Now, I don't know to what extent we have been following the politics of vaccines globally, and I classify it as such because it has become a geopolitical discourse.
In other news tonight, Governor General Sir Patrick Allen, during the throne speech at the ceremonial opening of Parliament yesterday, encouraged all Jamaicans to build forward together as we fight to overcome the impact of the COVID-19 pandemic.
We must never lose focus on creating a safer and more caring society where all can achieve their true potential. We must embrace reform with ambition. Our goal cannot simply be to return Jamaica to our pre-COVID-19 reality. We must go beyond this and emerge economically and socially stronger by addressing fundamental gaps that have been exposed and exploiting opportunities that arise. We must not only rebuild what we have lost. Every Jamaican, every entrepreneur, every civil servant, every business and every government agency must build forward stronger together.
The government has promised to introduce a digital birth certificate solution in the new fiscal year, which begins on April 1.
We have begun the process of transforming the Registrar General's Department, RGD, into the National Identification and Registration Authority, the NIRA, and the Digital Birth Certificate Solution, which is approximately 90% complete. This will be launched in the coming financial year.
Sir Patrick said the government is advancing the development of what it says are 4 complex priority pieces of legislation that are currently at the draft bill stage as part of efforts to tame crime.
Honorable members, resorting to violence cannot be the chosen means by which we as a people resolve our conflicts. The National Commission on Violence Prevention, NCVP, has been mandated to formulate an evidence-based 10-year national strategic plan to guide legislation, public education, and civil society mobilization against violence and for a gentler, more loving society.
Now, the pomp and pageantry that would usually take place for the ceremonial opening of Parliament was toned down by COVID-19 containment measures. The Jamaica Defence Force, JDF, commenced the ceremony with the escorting of Governor-General Sir Patrick Allen. This opened the curtains for a quick show as members of Parliament and senators descended both sides of Duke Street while observing the social distancing protocols, but without the usual cheers from hundreds of supporters from both political parties. Continuing with the news tonight, the police are seeking the public's assistance to locate 25-year-old Lynette Blake, otherwise called Cindy, of Ashton District, Westmoreland, who has been missing since February 12. She is of brown complexion, stout build, and is approximately 5 feet 5 inches tall. She has a large flower tattooed on her left upper arm and sports a low-cut hairstyle with burgundy-colored hair. Reports from the Barnett Street Police coming into our news center tonight are that Blake was last seen at her boyfriend's residence at Sun Valley Road in St. James at approximately 12 p.m. She was wearing a purple blouse, purple tights, and a pair of black slippers. She has not been heard from since. Anyone knowing the whereabouts of Lynette Blake is being asked to contact the Barnett Street Police at 876-952-2333, Police Emergency 119, or the nearest police station. In other news from Westmoreland, the police have listed 2 men as wanted for a murder committed on Hudson Street in the parish on January 11. They are Mark Watson and Delmar Cunningham, otherwise called Ratty, both of Hudson Street in the parish. Reports are that the deceased, 62-year-old Delroy Grant, had a dispute with Cunningham, during which Cunningham was chopped. No report was made to the police at that time. It's alleged that Cunningham, Watson, and 2 other men went to Grant's home at about 7:45 a.m. and attacked him using pieces of iron, a machete, and a hammer. The police were summoned and Grant was taken to hospital where he succumbed to his injuries on January 17. On February 8, the police conducted operations in the Hudson Street area, during which 22-year-old Ricardo Bailey, otherwise called Hollow Man, and 32-year-old Tristan Daly were arrested. They were both charged with murder on February 13 following interviews. Their court dates are being finalized. Meanwhile, the police are urging Watson and Cunningham to turn themselves in to the Savannah Lamar Police immediately. Anyone knowing the whereabouts of the two men are being asked to call the Savannah Lamar Police at 876-955-2758, Police Emergency 119, or the nearest police station. Citizens are also being reminded that it is an offense to harbor a fugitive. In news from St. James, President of the Montego Bay Chamber of Commerce and a resident of Montego Freeport in the parish, Janet Silvera, is calling on the relevant authorities to urgently attend to roadways that are in need of fixing in that section of the parish. Now, in an interview with our news team yesterday, Ms. Silvera described the condition of the roadway as disgraceful.
The biggest challenge I have is the road leading into Montego Freeport. We can be in a pandemic, but we don't have to look like we are suffering under a pandemic. And these roads are a disgrace. We're talking about craters that have been sitting there for months and no one is doing anything about it. The parish council, or should I say the municipal council, says that it's not their road. It belongs to the Montego Freeport Limited. And that chairman, I understand, lives in Kingston. We have not been able to ascertain when this road is going to be fixed. But what we do know right now is that those of us who drive in the community, we have had to be taking our cars to be fixed as a result of how badly damaged underneath carriages are.
Ms. Silvera further urged that something desperately needs to be done to fix the roadway.
I think it cannot continue. Somebody needs to do something fast. Our member of parliament lives in the area, and I'm thinking that she needs to know that on our behalf and speak on our behalf to Montego Freeport Limited so that they can do something about the road. In the past, when we had cruise ships coming in, the roads were being fixed. So I don't understand if it's because not enough tourists are being exposed to the conditions of the roads leading into Montego Freeport, why nothing has been done about it. But there are still 3 hotels that are opened. So I don't know if this is the kind of experience that you want tourists coming into Montego Freeport to feel. And I'm not batting for tourism right now. I'm batting for residents of Montego Freeport who have gone through too much on these roads. In fact, if they were to find a way to allow the water to drain away from settling in the road, we wouldn't be faced with these challenges over and over and over again. But every time the road is fixed and it rains, it goes right back to square one. So they're possibly fed up with the road themselves. But a solution must be found for the road.
Now, in speaking with a few of the taxi operators that traverse the Montego Bay to Freeport route, they also shared in Ms. Silvera's plea for the roadway to be fixed.
This place over 2 years now. They fix part and left part. When rain fall, we can't go through a deep hole of Jackina. Mash up the whole of the front end. You understand? From when we beg people, every minute we see them carry 2 and a half sand control night. Mal, as rain fall, everything lick out back. A long time we want to fix. Long time. So we're glad we see the authority represent, we can put it on the year, say the road we fix. Or we can save the front end because in the corona now, we can't really make no money because we bypass one vehicle. Very, very terrible. Through the corona, they're not interested again because push a tourist down here again. I'm going to look workers we carry on the apartment them. You understand? We drop off 1 or 2 tourists are secret. And they have them staff boats, big staff boats. But it's very, very bad for me because we have a skip patrol, jumping a patrol every minute. In a busy tourist area with 2 big hotels and whole be rich people live so be rich people. No poor people, be rich, be hardy, be Benz.
Yeah man, the road bad man, they mash up my motor man. All the while I say stay. Because then just surely come all night and time me down he come on back.
I'm in Reds man. I'm a tell us the road is in a bad condition.
Meanwhile, Janet Silvera says special attention needs to be given to roadways in the town of Montego Bay, especially St. James and Barnett Streets, with defective manholes.
For our downtown area, there has to be some type of pride. There must be special attention that you would want to place on downtown Montego Bay, and I'm not seeing that. I walked the streets on Sunday and I saw the 3 manholes. 2 of them are so dangerous that a woman who was walking on St. James Street approximately 2 months ago fell in one of them and dug out her knees. Those holes or those manholes have been left uncovered for the last 5 months. You want to tell me that nobody in authority has seen a reason to cover them? The fact that you have people who are blind, people who are old, people who are just not going to see it once they're walking down St. James Street. Then when you go on Barnett Street, which is one of the most popular streets in Montego Bay, the craters that are on that street, it is disgraceful. It is time that either NWA, if it is NWA who fixes those roads, do something about it. Because we cannot look like this. We can't continue to not be paying attention to the downtown area of Montego Bay. It's almost as if it has been abandoned if we're not careful. Because we have other areas now that are part of the city that are doing well, it is almost as if downtown Montego Bay is no longer important. And that remains the nucleus, the energy of the city. So we have to take care of it. We cannot allow it to break down in the way it has been broken down.
The president of the Montego Bay Chamber of Commerce is further appealing to the relevant authorities to step up in helping to fix these roads.
I'm calling on the mayor of Montego Bay, the councillors in charge of the various areas, to go out and ask, or should I say, lobby on behalf of the city. If the money is not here in Montego Bay, then they need to go and lobby the Minister of Local Government. This city in the past has helped the rest of the country. In other words, the money that we make here goes out of Montego Bay, goes into Kingston and into the coffers, into government coffers, and has helped this country. Now that we're not making as much as a result of what's happening around us, I would think that we should not be abandoned like this. More care need to be taken, and we must be seen as a people who are as important as the rest of the country.
Community Relations Officer at the National Works Agency, NWA's Western Office, Janelle Ricketts, pointed out that these roadways are on the agenda to be dealt with. However, a set timeline cannot be given at this time.
The National Works Agency is now in the process of repairing several roadways in and around the city of Montego Bay, St. James. We have a patching program valued at just under $10 million that targets several roadways, including the Alice Elimaya Drive, sections of the Howard Cook Boulevard, and also the Barnett Street. These are just a few of the roadways that we have been targeting as part of ongoing efforts to repair several roadways across the parish. There are at this moment several defective manhole covers that we will also be seeking to address. Our technical team is in the process of doing the necessary damage assessment and formulating the appropriate solution. We intend to have these fixed in short order, and as a temporary measure we will do the necessary to ensure that pedestrians are safe as they traverse the affected sections of the roadway. At this time, I'm not able to give a timeline, but it will be dealt with as a matter of priority. We are in the area already in terms of the preliminary works, in terms of getting the areas prepared for patching, and we will also at the same time be looking to have these areas remedied.
And those are some of the stories making news. We will return with more stories as counselor and caretaker for the Carwell Division in Western Hanover, Tarek Donaldson, has partnered with Professional Eye Care Company to offer free eye examinations to residents of that community. And the Jamaica Public Service Company, JPS, in collaboration with Agro-Processing Corporation, CB Group, is undertaking the construction of a new power plant in what the electricity provider says is a first for Jamaica's energy sector. But first, we'll take a break, and then it's over to Christopher Scott with the very latest in sports.